Hello, 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 everyone. This is Dr. Taranda Knight here with you, the Behavioral Health Queen. I'm Behavioral Health Talks with Dr. TK. Thanks for joining today's podcast here on Podbean Live. No, this is not in conjunction with TikTok Live today. This is solo by itself. Yes. So here today to talk with you guys, those that are listening now or maybe listening later, on leadership, population health, and prescription policies. Now, I have to say that I am not a licensed professional. However, I do have education and background in the field. But I just want to bring certain things to your awareness. And so today, I just want to kind of help you discover how higher education leaders can transform population health outcomes by addressing prescription drug changes that impact students' academic, mental, and physical health. So let's learn about some strategies, policies, and measurable outcomes that improve access, reduce burnout, and create healthier, more resilient campuses. Yes. Now, I don't know if you all know this, but prescription drug changes can basically derail a student's health and their future. And it's not just students, it could be faculty and staff or anyone. It could be you out there in any role you have. Imagine losing access to your ADHD, anxiety, or depression medications mid-semester. Hey, the results can be devastating. You can fail grades, have increased mental health struggles, and a higher risk of dropping out. So let's talk about this. The truth is that leadership and population health strategies can turn these moments of crisis into opportunities for resilience and growth. So once again, you guys, welcome to today's episode, Leadership, Population Health, and Prescription Policies in Higher Education. Now, this first part is talking about the challenge. Let's talk about the challenge for a little bit. Mental health diagnosis among students is increasing. More than 40% of students report symptoms of depression and anxiety. Many are prescribed medications that helps them manage daily life. So that's a nice amount of a population of students that's requiring some form of medication, right? Now, when we look at prescription medications, it's something to think about on a full spectrum. So let's look at this. Here's an additional challenge. When prescriptions are interrupted, whether it's due to supply issues, insurance, or just institutional red tape, students face disabling symptoms. When we look at these two challenges that I've stated so far, we have to take into account that we have to figure out a different approach, right? And for centuries, we've used the process of seeing a provider. The provider places you on a medication. You take it, try to be consistent, and then something happens, whether it's environmentally, changing your diet, whatever the case may be, but it impacts the effectiveness of that medication that may have been working, but now isn't. And so now you have to go back in for another evaluation by your provider to determine, number one, maybe what's wrong, or number two, what other medication you can be placed on, right? So imagine this. If we took healthcare from this perspective of use and prescription medications, but not as this long-term mindset we've had for centuries, right? And utilize things that the body can naturally recognize and finding out the appropriate amounts individuals need in order to bring stability to what naturally already operates inside of us, right? Now, in order to do that, we have to look at things like nutrition, diet, and vitamin supplements, right? Now, those are things that can definitely help in the event individuals have to go without the prescribed medications. Now, what would make it become ineffective is that prescription medications come with its own set of side effects, and withdrawal symptoms sometimes depend on what you're taking. I know that a lot of anxiety medications can come with side effects. Once you start tapering down off of it, that's similar to the withdrawal symptoms of coming off of opioids or alcohol. But with those things in mind, we can say that we understand now that mental health diagnoses is on an increase, and they're reporting more problems with depression and anxiety, and therefore prescribed medications is basically what's helping them function. We don't hear a lot about diet and nutritional supplements, right? And so, but because they need these prescriptions, information has to be maintained and managed. Higher education professionals have to become aware of their students because they are there for their academic success. And in order to get full academic success, we have to be willing to basically meet the students where they are, understanding the things that they are dealing with outside of the classroom. It's not just about standing up in front of a class giving lectures or teaching them or providing support or mentorship. It is about understanding them, their mindset, their physical and behavioral health, because those things impact everything that we do in academics. Now, when faculty and staff and leadership understand that concept, it helps them with being able to manage their sense of burnout. Why? Because now they're less likely to blame themselves for maybe not fully looking at the full spectrum as much, and they have an opportunity to bring change once they start looking at those things, right? So this isn't just an individual problem, it's an institutional problem. So because when students fail or withdraw, retention suffers. Faculty workloads increase, staff burnout rises. And most of the time we realize that the faculty's and staff's workload increases because now the accommodations have to be given to the students. A little bit more management has to occur to make sure to meet the student where they are and that they're not just falling through the cracks, right? So it takes a team approach and not just that of the actual faculty or staff teaching them or providing instructional. It has to come from a space of who are the behavioral health and medical staff team that's working with the school that's involved. Who are those that's working in the disability accommodations office that's working with the student as well? Where can we utilize volunteers and other professionals to help with the success of the student as well? And then finally, the next and final challenge is, this is the challenge higher education must face head on, right? All of these things encompassed together is the final challenge. Knowing that these are factors that students experience, not just on the mental health and substance use and medical side, but knowing that when prescription drugs are required, prescription drugs then add another layer of factors to the challenge, because those things can derail a student's success, mostly because if they go without that medication, it's going to cause some side effects. And those side effects could impact the cognition of the student and their ability to remember, retain information, or it may causes changes in their actual mood. So all challenges that the actual higher education institution has to take into play in order to fully meet the needs of the students, and making sure that by meeting the needs of the students, we're meeting the needs of the faculty and staff as well. The next part is, think about population health approach. How can we approach this factor from a population health standpoint? Now, we understand population health is looking at some health aspect from and addressing it on a larger scale, not just on a one-to-one basis, right? So we're looking at it, we feel like if we can help multiple people with the same thing, then we are basically bringing about the aspect of population health. So population health looks beyond individuals to actual groups, and it asks, how healthy is the entire student body? How healthy is the entire faculty and staff body? What and how resilient are the faculty, staff, and students? What's helping them to be resilient? And how are they actually attaining that? So what happens to outcomes when systems fail? These are the things that population health helps us look beyond when looking at groups. We'll put it this way, a single missed prescription might not seem like a leadership issue, but when hundreds of students face the same barrier, it becomes a population health crisis. And on larger universities and colleges that has over 1,000 students, that can happen very easily. Now think about this. Many campuses have encompassed the solution of 24/7 telehealth access, hybrid care models, and proactive prescription management address the group while supporting the individual. Now, telehealth has become a very important and detrimental thing to healthcare since COVID-19. Although it existed before then, but was not billable by insurance, right? It became very important once COVID came because people needed access and without increasing the risk of death from obtaining COVID-19 without having access to vaccinations and various different medications to treat it. So when we look at this is the same care model that came out of COVID-19 and into the world of healthcare as a whole. Now it's fundable by majority of most insurances, and many people that have certain insurances don't even have to pay anything or as little as $25, right? Now, when we think about these things, if we put and have access to these factors on every single campus, then what happens is students now have access to medications, right? They have access to professional providers in those specialty areas, okay? And so when they leave home, they now can go to school and not have to worry about finding that particular provider in their area or feeling like their privacy is being violated by the college or university that they go to by obtaining services on campus. How cool is that, right? So here's an example to think about. A campus that added telehealth reduced the average wait times from 72 hours to under 24 in just 3 months. Now that's called impact. To actually bring that amount of change to the spectrum of access to care is evolutionary. I love it. And we have to do more of these things throughout the campuses across the world. So, as you know, I'm here as your educator, and I am going to educate you on things that you probably didn't even think about. And that's why it's important to stay tuned and also follow me and share with others so that they can have access to the same level of information. Now, let's take a look at leadership and policy solutions. Now, this is the nitty-gritty, right? So here are 3 strategies leaders can adopt. They can guarantee 24/7 access to care. They can establish rapid response systems for prescription disruptions, build trauma-informed policies to leave or for leave and accommodations. These are things that can be put in place if not already, or they can be updated and improved to make sure that they meet all the needs of the students. And many times it's best to talk with the students to see exactly what are some of those experiences that they are going through as leading to those changes. Okay, what's actually happening and what's the time frame around these things happening, where their medications may be leading to some changes that is preventing them from being academically successful in the moment. That is where my tools come into play. Put them in place on your campus, gather that data and information that you need from the questions that's provided, and watch and see the amount of information you get that can help improve the outcomes of the students on your campuses. And better yet, these same interchangeable tools can be used with your faculty, staff, and leadership as well. So, hey, it's a two in one. But these are not optional, these are basically essential. Leadership must also align with the framework like lead, listen, emphasize, align, and decide. So leaders who practice empathy, they actually create trust. Now, do I honestly believe that trust exists? Only to minimums. And we like to use the word really strongly as if it sets some foundation of some sort. But trust is an illusional element. It's something that basically put into play with business and within the field of business to help other organizations and individuals decide or utilize as a factor of elimination. But does true trust really exist? Most of the time when we look at this question, we have to say that the true answer is no. And that's only because our prior experiences prevents us from really experiencing what real trust looks like. If you find yourself constantly asking the people around you questions when you feel uncertain, then that's a clear indication of what I mean when I say we don't fully trust. If you first meet with someone for the first time, you've never experienced their presence before, and you feel a little skeptical or you are a little bit reserved, that is what that means about the element of trust, whether or not it exists. Because true trust means you trust someone until they do something in which you don't trust them. But you never go into the circumstance not trusting. And that's the truth. Now, when we look at leaders who align policy with students' needs, it creates equity. Leaders who decide boldly create transformation, because that's the key here. How can we see or bring about a convoluted amount of change that's really positive, really productive, and comes with a spin on it that cannot just help a certain amount of people, but a larger amount of people? And so that's why my niche is in higher education, and it focuses on the leadership, because if we can actually work through leadership, we can work through all the nicks and nannies that trickles down to the student. Because guess what? Leadership are the leaders and everyone else follows. Imagine being the leader of a school, and every time your students see you, you are pacing, you are shaking, you are unable to hold eye contact, you seem agitated. That's going to be real discerning to the population in which you seek to follow you. And many times it can put off a sense of intimidation or fear in the environment around you. So now, let's look at this last piece, last but most important. Outcomes and inspiration. So remember when I stated about the tools of assessing the students to see what their core needs are, like what have led to you needing prescription medication changes in the past? What were some of the situations that you've experienced? How long did it typically take you in order to get stabilized? And what were some of the things you experienced while you went through that experience? Keep that in mind, because outcomes and inspiration is key. But remember, outcomes must be measurable, and we have to set them within realistic senses of time frames. Anything that involves other people comes with the possibility in which it may not get achieved, because manipulation does exist and people's resistance does exist. And those are all factors you cannot control. So when you set these measurable outcomes. Know that whatever your target is that you set, it may not come to be an actual reality, but it will give you the stepping stones to show where you are growing. And here's an example. So say if we stated by 12 months, we set targets like 75% of students reporting improved stability, okay, by 12 months. Or retention rising by 10% within 12 months. Or faculty burnout reduced by 30% in 12 months. These outcomes aren't just numbers. They are lives changed, degrees earned, and futures restored. And that is what true leadership seeks to do: improve the lives of those around them. Take and respect those that are following them, regardless of what their title, status in society is. See them as the human beings they are and provide the unconditional sense of support that they need. Seeing the opportunity to identify where we can actually bring about change. Now, I've talked about some really good stuff, you guys. And I don't know if you all were listening. But if you wasn't, hopefully you will replay this and listen to it once again. I chose to keep it short, simple, but sweet. So today, remember that prescription drugs can derail students, faculty, and staff lives. Okay? It can impact their futures. Mostly, number one, because prescription medications are used mostly as stabilizers or ways to help improve the symptoms someone may be experiencing. But they can also cause other side effects that can lead to more medication, that can lead to more side effects. Okay? And you take two medications that haven't been studied together, and you don't know what the side effects of those medications will project off onto that individual. And so, with that said, we have to listen to the actual patient, the student, the faculty, the staff, or the leadership that has to be on prescribed medications. And if you are a healthcare provider listening to this, know that you can always start with supplements and dietary changes first by linking them to a dietitian and making sure you do the proper lab work to identify with the actual deficiencies that they have and treat those so that you can bring about sustainable and improved health for the long term. Medication used short term, but nutrition and diet and vitamin supplements is something a person can live with for the rest of their lives and be successful, because everybody needs income to survive. So your faculty, your staff, and your leadership needs income. They need their jobs. Okay? And the students that are investing in their futures need to know that their academic success is going to be respected, maintained, and also treated in a sense where they're actually heard. Now, before we wrap up, I just want to reiterate a few things as a reminder to you so that you can move forward in a way that's very strategic, and hopefully you can see where my services may be a benefit. However, remember, students are having an increase in depression and anxiety. Okay, so prescribed medications are going to be needed, or some form of dietary change or supplement is going to be needed as well. Either way, it's going to take them a time frame in order for them to feel their best, to perform their best, and they need policy and procedures that protect that for them. Now, remember that with population health, we're not just helping one person. We're helping a group of people. So it removes that mindset of as long as I help one, that I'm helping. No, we want to be able to help many. It's just like with COVID-19. When they decided to make the vaccinations, it wasn't about helping one person. It was about how can we help more than one person that has the same factor or issue. And that is what this is about. This approach comes with the same mindset. How can we utilize something as simple as that to improve the lives of individuals? Remembering that having access 24/7, whether it's virtually, which is what telehealth is, virtual access, so it means that they have access to professionals, and those professionals could be anywhere in the world, but they take their insurance and they are responsible for providing them with the care that they need in that time frame to reduce the wait times for individuals, because it's those wait times that put them into crisis, and now their healthcare cost goes out the roof because they have to go into an inpatient facility to get stabilized and then referred back out into the community. That is lost time away from school. And most of the time when they go inpatient, it takes about 3 to 14 days to stabilize most of these symptoms to get them on the right medication they need in order to thrive. So remember that. I understand this is an industry and we all need income and money. The hospitals do, the doctor's office does, but this is how we can make it work. Save the emergency room for the real health crises, right? And utilize the outpatient-based services for those that want to go and walk in or don't really need that crisis level of service or that right now level of service. And for those that need that right now level of service, hey, 24/7 telehealth is the key. And they actually have providers that can continuously follow up with individuals as well. So there are programs out there like that so students or faculty and staff don't feel like they have to jump around to professionals and providers. And then remember, establish that rapid response system for whenever prescription disruptions occur. What do your policies look like for your students, your faculty, and staff to protect them and safeguard them, not discriminate against them, and make sure that they're keeping a continuous sense of financial flow if they're faculty, staff, and leadership, but also support if they're students that are seeking to be academically successful. And then make sure you build those trauma-informed policies for leave and accommodations. Hey, we have to think about this, guys, and work together. That is what it's about. So remember, I'm Dr. Serena Knight. I am a doctor of behavioral health. I have a Lean Six Sigma Green Belt certification, and I actually did my track in integrated behavioral healthcare leadership. But I also studied the integrated healthcare process as well. But know that I understand the principles of healthcare leadership, and that's what's needed to be successful in higher education. Knowing all the quirks that's there, from insurance to students to faculty and staff and leadership capabilities, and what we look for in those areas. So follow me on all platforms. Visit my website at www.virtuallyrenownedconsultingaccessllc today. And that's llc.org. I didn't complete that. But visit there today. Look around. There's lots of information and articles. Most of the articles are now tied to my services, so you have to actually be within my program to receive that. But no, the bundles give you so much access to webinars, to articles, to support and guidance through consulting and coaching. So why miss out on that? So join me today. I'm on TikTok, Facebook, Instagram, and LinkedIn if you want to know more about my professional background. And until next time, be great.